Hi, I'm Dr. Barbara Reynolds, and I'm the Crisis and Risk Communication Senior Advisor at the Centers for Disease Control and Prevention out of the Atlanta headquarters. And I'm here to talk to you about crisis and emergency risk communication. In an emergency, when people's lives have been turned upside down, when the thing that they never thought could happen to them has just happened, I know one thing for certain, that the right message at the right time from the right person or organization can literally save lives. And that's why I've dedicated my work at the Centers for Disease Control and Prevention to doing this work, crisis and emergency risk communication. So let me tell you a little bit about how it came to be. Back in 1997, ancient history for some of you, I got a free trip to Hong Kong courtesy of the CDC because there was an outbreak of a novel influenza virus called avian influenza type A H5N1. Some of you may have heard it. That was often referred to as the bird flu. Well, I went to Hong Kong as part of an epidemiologic team, and our job was to try to figure out what to do with this novel virus that had the potential, from everything that we were seeing, to become a severe influenza pandemic strain of flu. Now, you may know that influenza pandemics are caused by novel influenza viruses, but there's a couple of other things that have to be present for a flu strain to become a pandemic strain. It also has to be virulent, meaning it causes serious illness and death, and it has to be easily transmitted from person to person. When we went to Hong Kong in '97, we knew it was novel because it was the first reported cases ever of H5N1 in humans, and we knew it was virulent because it was killing healthy, and I want to underline that, healthy young people reminiscent of the 1918 pandemic. So we were there to figure out if it was easily transmitted and to see if there was some way to prevent the outbreak from growing into that pandemic. Now, that wasn't my job. I was there as a communications professional. But when I sat in that hotel room late at night, I thought about all that I had known and been taught about communication. And I realized there were major gaps in trying to figure out how to talk to people about what could be the most devastating thing that could happen in their lives. I didn't have the answers. In fact, I felt wholly inadequate to the task. And it was through that experience that I dedicated my career from that moment forward to trying to get to those answers. And I borrowed from every field that I could think of to create what I believe are some best practices and a way forward to help anyone who finds themselves in that hotel room trying to answer the hard questions for people when their lives have been turned upside down. Communicating during an emergency is very different from communicating outside of one. People affected by an emergency have special and specific communication needs. That's why in 2002, CDC published best practices for communicating during a public health emergency. The Crisis and Emergency Risk Communication, or CERC, curriculum is based on lessons learned from previous responses, communication science, and psychology. Although the curriculum has been updated to include new technologies and emerging public health threats, the principles remain the same. By using CERC principles, you, as a communicator, can provide the public with information to make the best decisions for their health and safety. CERC helps the public make the best choices they can during an emergency, despite high stress, limited options, and little time. In an emergency, with so much uncertainty, good communication is crucial. People need simple, easy-to-follow guidance from experts. This information can help them determine which actions can protect them and their loved ones. People often remember short, simple messages that are easy to understand and act on. They compare what they are being told to do with what they already know, and they look for second opinions to validate their decisions. and believe the first thing they hear is the truth, whether it's right or wrong. So it's important that your messages are clear, and you should consider any possible barriers to understanding when creating your messages. Some barriers are psychological, including fear, denial, hopelessness, and stigmatization. People respond to emergencies in different ways. Many do not believe they're a new reality. Others feel fear and abandon the hope that they or anyone else can do something to make the situation better. Some members of the community experience stigma, others stigmatize. As an example, during the 2014 Ebola outbreak, people in West Africa were stigmatized as carriers of the disease simply because they lived there. As a communicator, you must also be aware of the myth that the public panics in an emergency. Panic is often associated with irrational behavior, but in an emergency, few people actually panic. Most respond to an emergency in ways that make the most sense to them based on their experience and the information they've received. For example, several healthcare workers abandoned their positions in West Africa when Ebola began to spread. While some might consider this a panicked reaction, to those doctors and nurses, leaving their jobs and distancing themselves from the disease was the most logical way to protect themselves and their families. All of these issues affect how people receive and react to public health recommendations in an emergency. There are other barriers as well. People don't accept all risks equally, even if the risks have the same outcome. For instance, imagine that a person goes skydiving and breaks a leg. Since the action of skydiving was voluntary, the outcome of a broken leg may be more acceptable. But if that same person crosses the street, is hit by a car, and breaks a leg, the outcome may be unacceptable and can even spark outrage because it was involuntary and imposed by someone else. Usually, disasters that are natural events, such as severe weather, are easier to accept than those that are man-made. And disasters that affect adults are easier to accept or less upsetting than those that affect children. As a result, you must consider how people perceive a risk and how this perception may create a barrier to effective communication. To measure risk perception, you need to consider both the scientific measure of risk, the hazard, the level of emotion, and the outrage that the risk or outcome provokes. The greater the public outrage or emotional reaction, the greater the demand for information. Different combinations require different strategies for communicating. A low hazard, low outrage is of course an ideal situation. In this case, the public health threat is low and the public is reacting accordingly. In a high hazard, high outrage situation is where CERC really begins. You must help people deal with what's happened. High hazard, low outrage requires helping the public understand their risks to motivate them to take positive public health actions. And low hazard, high outrage requires you to provide information that can help people manage and hopefully lower the public's outrage. Also, lack of trust can be a barrier to effective communication. People affected by an emergency judge the way a response is handled based on trust. You can promote trust by doing what you promised to do. Conversely, you can easily break that trust by making promises and not following through. Mistrust makes it incredibly difficult to communicate during an emergency. Without trust, people may ignore public health recommendations meant to keep them safe, which increases their personal risk of life-threatening injury or illness. CERC offers some ways to maintain trust in emergency situations. Accept that people feel scared. Communicators shouldn't try to eliminate fear. Instead, you should help people manage it. Don't over-reassure. Over-reassurance may lead to mistrust if the situation doesn't turn out as well as promised. Acknowledge uncertainty in words and give people positive actions to help them regain a sense of control in a very chaotic situation. Only make promises you're sure you can keep. You will only increase trust if you're able to deliver more. The right message at the right time from the right person can save lives. As an emergency communicator, it's your job to provide information that people can access, understand, and use to protect their health and safety. CERC can help by identifying best practices, possible barriers, and offer valuable tools to increase your effectiveness.